I am here to ask for your support to provide a definition for palliative care in the statute in order for future reimbursement for this approachment to managing patient care. Palliative care is an interdisciplinary team approach to assisting patients in managing their chronic disease focused on mind, body, and spirit. Healthcare delivery models are based on best practices, which means as services are delivered, research has been done as to what approaches that lead to best outcomes for patients and their families. An individual with chronic disease is daily dealing with symptoms that may be physical, as a COPD, chronic obstructive pulmonary disease, diabetes mellitus, neurological disorders, and the facets of daily living that impact that individual. The intent is to have the definitions in place so that when Medicare acknowledges reimbursement, Medicaid is able to recognize the program and reimburse.
This bill contains two important components for increasing access to palliative care for South Dakotans living with serious illness. First, the definition of palliative care, and second, the provision of education through the Department of Health's website. In addition to being the program manager for SDAHO, I am also a specially trained palliative care social worker. I was part of an interdisciplinary team that provided physical, emotional, psychosocial, and spiritual care to people living with serious illness. I am also a palliative care patient. I live with multiple sclerosis. While I will not die from it, I will die with it. Since my diagnosis 6 years ago, I have experienced increased symptom burden, a negative impact on my quality of life, emotional challenges, employment issues, caregiver stress, complicated treatment options, and an overwhelming array of medical stuff. Because this is not a terminal diagnosis, most people would not think of me as needing palliative care, but I knew better. I referred myself. The team I previously worked with is now my team, working with me. I work full-time and stay active with my family, friends, and faith community. With the passage of Senate Bill 147, we can make sure that South Dakota healthcare professionals and patients fully understand the definition of palliative care and receive a consistent, accurate message about who is eligible for and the benefits of palliative care.